It's 8:33 and there's not a quorum present. I believe 1, 2, 3, 4, 5, 6. We have 3 out of you. 3 out of 6. I think that
I could vote
I don't
twice,
count.
right?
That's a quorum. Half the folks there is a quorum. So
Right.
let's go ahead and
Okay.
do our business today.
It's real short anyway.
So it's 8:34. We'll call to order the meeting of the Joint Insurance Committee. Item number 1. Maybe I'll help you out here a second, Jason. And item number 2 is approval of the minutes from August 6, 2014. If the committee would take a minute to review those and have any comments and adjustments if necessary. Sylvia thinks to approve. We have a second for Mr. Connor, so seeing no objections, I assume we've approved. Item number 3 is information from vendors. We didn't have anything special to share with anyone at the moment. Our vendors are here if there's any questions from our medical plans. Item number 4 is information from my office. Summary, we're doing okay. We're about where we should be. You can definitely see, though, that what we're spending on prescription drugs is ramping up on the active side of the house. And you can see that average cost is probably, we're going to spend more than we did last year. Medical claims are ramping up too, so the trend's there. It coincides with the premium renewals we received for 2015. So on the medical side of the house, then the way I look at it is that average year-to-date claim per month, we've gone up from 750 to $1 million. I mean, I'm sorry. Let me look where my bifocals here. We're running at if comparing this year to last year, that we are pushing upwards on that trend, and a lot of it has to do with prescription drugs. And otherwise, the United Healthcare plan it's a fixed premium, and it went up. It's it's a stable thing, and then the dental and life are very stable programs. So they are what they are, and I can talk to you about open enrollment and the renewals that came in for 2015 real quick. Life insurance is not going to change. It's a flat. They're going to roll over the premiums for 2015. Dental insurance is going to reduce by 5%, and that's because our medical loss ratio on the dental side of the house has gone down, and this is the second year of a 5% reduction. So that's the good news. The not so good news is on the medical renewals. On the HMO side for actives, it's going to go up 7%, and that's probably within the market, from what we understand and what we've seen in what I'm aware of other people. That's justifiable, the 7% return. Part of that is also that United Healthcare, because they're in an insured plan, has to pay an Affordable Care Act fee, which is around 3.2% or so of that total premium spend because of the market stabilization. So that's part of the factor in our renewal. But trend-wise, prescription drugs are up because what I'm being told from Express Scripts, from United Healthcare, is that the ingredient cost is up 9.8% across the board. So that's the actual cost of the drug. And then when you add on administrative fees and the mix of drugs that are being purchased, and when I say that, the mix of drugs, we've definitely seen the new medication for hepatitis C. We've had one claim on that, and one claim on that is $100,000. It was on an active in person. So a population our size, we are going to see another one of those, and that's for one course of treatments is $100,000. So we will expect more of that. We've also seen heavy utilization of compound drugs, and the compound drug industry, this is pharmacists, because those are no longer regulated, because once you take the drugs and you mix them together, they're not a federal legend drug. So the pharmacists can charge what they want, and so pharmacists have figured out a way to charge a lot more for those. We are implementing on the indemnity side of the house a compound management strategy that's going to put some controls on the compound medication dispensing. On the United Healthcare, they're pretty tight on it anyway to start with, so that's not so problematic for them, because they do. So what the indemnity plan is going to look more like what United does about getting prior authorizations and justifications of why you have to have this compound drug. And a lot of people take compound drugs because it's the delivery system. Instead of taking 2 pills, they get a topical cream for like pain medication. It can be delivered that way. And it's become an area of waste and fraud and abuse. Compound drugs are, what I'm being told, is just getting out of control in the past year or so. So that is a pain point for us, but we are addressing it. The other side of the house, medical claims are just what they are. They seem to be ramping up. I think the market has, and Larry can correct me if I'm wrong here, but after everybody was nervous the past couple of years about the Affordable Care Act, they shifted around and kind of controlled prices, and now they are reshifted again because I think there's a lot of anticipated I don't knows out there for 2015 and 2016. So they're readjusting their prices from the past historical business, and it's putting demands on that rate increases. So on the HMS side, I'll bring it back around since I meandered a little bit. It's 7% increase, and on the Blue Cross indemnity plan, it's a 12.27% for the actives. From all that we can tell in our vetting of it, we're in the ballpark, and that's unfortunate for us, but that's what it is. The active side of the house, the retiree side of the house, the under 65s on United would be going up 12.3%. And then on the standard, the Blue Cross Blue Shield plans, they'll go up 27% for under 65s. They're particularly sensitive to the prescription drugs because they're a small group, and how those prescription drugs spend on that small indemnity plan group is hitting them. For the over 65s, the HMO plan will go up 9.2%. That's on the Secure Horizons plan, and then on the indemnity plan, it's a 19.5% increase on the medical side. And on the retirees, also remember that they also have another 2% contribution overall increase because we're moving to a 50% share of the premium, and this will be year 6 of that move. So we've gone from 30%, and now we'll be at 42% of the premium. So the retirees number looks a little worse just because there's 2 factors at play. So there's a 2% increase plus the general plan rate adjustment. So that's how it affects them in their pocketbooks, the numbers I mentioned to you guys today, the actual dollars that people will spend. So it's not one of the most pleasant years, but it is what it is. I think that's about the best I can say. And we pushed those rates down as best we could with both carriers and get it down to a reasonable place. And we just think between our utilization and our drug spend and our cost sharing, that's where we end up today. So Questions, statements? Shocked? Yeah, I'll be seeing the retirees tomorrow night. So, I'll see a group. They're, yes, this is unsustainable, it's too high, so this will push plan design changes for 2016. So when we go through, and our plans on the active side have to be negotiated with our labor unions, plan design changes, so this will be the evidence to say, okay, we've got to increase our prescription drug co-payments because the ratio's out of whack, because cost per claim against what the member contributes is lower now. So that would be one of those things one would put forward. So yes, the answer to your question is this will be a move for plan design changes for 2016.
Does the city provide any premium discounts for the wellness program participation?
We don't have a wellness program, so we do not provide premium discounts.
Is that a consideration in the future?
We have proposed wellness programs, but we've not been able to obtain funding for a full wellness program.
And so is there any thought on heading towards some consumer-driven plans as options to allow
Our
plans to manage their costs a little bit more effectively if they do realize?
A consumer-driven plan has been raised up the flagpole, but our culture is not very accepting of a consumer-driven health plan yet. Yes. Yep. Well, members, if they wanted, 60%, 63-4% actually of our populations moved to the HMO plan, which is the lower cost plan, which is the one with the 7% increase. And it's historically not been too bad the past few years. It's been in the 4% range. So members may shift because they'll be price sensitive. And so the HMO has a lot of strength on the active side of the house. On the retirees haven't, they can go to the HMO plan. They can move off that indemnity plan, the Blue Cross sponsored plan, if they wanted to, but there's their own resistance to changing that. So there is if people would shift, that would save us and them money. And on the over 65s, we offer a Medicare Advantage plan through Secure Horizons. That is the lowest cost plan, and if people would move off our higher cost plan onto that other plan, they're going to save themselves a lot of money. And in fact, we're going to address that tomorrow night, because United Healthcare is going to have their Medicare people we open up with the Retired Police Officers Association Thursday evening, so they're going to try and educate that population that we do have an alternative that they can move to. And we also have an alternative Blue Cross plan that we have two of them for retirees. So one of them has much higher deductibles, and it's just a little bit of a smaller network, and it's about $150. It's a good spread between the premiums per month. If people would just move to that, but we have all of 60 people on that plan at the moment, so as opposed to 1,800 on the other side. So if they could get them to move to that lower cost plan, everybody wins. So
This in-house clinic that you're opening?
the in-house clinic is going to be for active employees and retirees under 65. Because the Medicare people, because Medicare pays 80% of that medical cost, it doesn't save us any money. So that's why we didn't include them in that clinic. But to move forward for the employee medical clinic is the theory that if we early disease intervention, early constant disease monitoring, get people away from wasting time and wasting encounters, if we can get them easy access, and we can provide them a prescription drug when they walk out the door if they need it. And that way we're going to get better compliance. That should drive our costs down, but that's a long-term play. So think 18 months to 24 months before we'll really start to see something spin out on that. So we're taking a bit of a risk to go forward with an employee clinic, but we think over the long term it's going to be a good return for us. So we're trying something.
What is the budget outlay for a wellness program? Do you have any idea what that is?
I don't want to get into that in a public forum today, because that's a budgetary management decision.
Oh, okay.
Okay, and
I was
so,
just
yeah.
curious.
I'll talk to you privately, but I'd
No,
rather,
I was curious.
Okay.
Anyway.
it's not, but to answer your question, it is costly for a population this size. It needs to be done right with an advocate, and promotional activities and management of a wellness program. And when we have 3,500 employees, you've got to feed and nurture it. And then when you create incentives for people to participate or disincentives, that there's a cost factor with those. And all of a sudden the law of numbers catches up with us. So I don't want to get into specifics, but that's been the problem.
You did research with like major private companies that have good wellness.
We have, and major private companies that have wellness programs, they put a lot of money into it. And they have a culture that is a little more flexible than ours, such as you go work out when you want to, and they have an on-site gym facility, fitness center, and that's paid for by the company. And we don't have the facilities for it, accessibility, and a culture that says if you want to leave your office at 2 p.m. for an hour, that it's okay. And that's not how we do business right now. So it's a cultural shift. And we have a 24/7 operation of police officers, firefighters that are dispersed throughout the metro area. So how do you provide them adequate access? And we also struggle with even more remote, and people that are in the field, they're all over town doing what they do. And so how do we get them engaged and into services? Because it's not so flexible for us for those reasons as you could look at one of our companies across the street here that has a massive operation, and it's headquartered and everybody's right there. So it has been talked about, but we haven't had an answer yet. It's not a no, it's a I don't know yet. It's a struggle. Okay, I'm babbling today. So. Is there any other questions about anything else, or where we're going, or? I will meet. My meetings may not be happy because the retirees are very, they're price sensitive. I understand that. But I do want to reemphasize I have alternatives, and they can go do something different. And they are under pressure because we've been increasing this in the 2% every year, and it's getting more painful as that comes to play. But the city council said we want retirees to contribute 50% of the premium, whatever that premium is. So that is the political directive, and so that's where we're going. And so as inflation and time goes on, that gets more painful to folks. But we will be meeting with retirees tomorrow night, and then I have another one within the next 2 weeks. We'll be seeing the other two groups, and our open enrollment is open today for everybody. It starts October 1st, so it'll last for the next month. So people can go ahead and do their electronic transactions. We'll have a week over at the Civic Center, about 3 weeks. Okay.
Can I ask a question?
Of course you can ask a question.
We made some prescription drug plan design changes this year that went into effect like January, February this year.
February.
You see that the Express Scripts price dropped pretty significantly in May. retiree side, there's not a corresponding drop. Is there any reason why that impact showed up in actives but not retirees?
I have no specific reason why that would drop. But I do know the retirees are spending more on prescription drugs. Our retirees are buying more drugs, the inflation cost is up, and there's been that compound thing. So there's three distinct patterns in there. And the retirees are blended in this number for the under and over 65 group. The unders are heavy utilizers of medication, and that is part of the deal. Now, we instituted an employer group waiver plan under Medicare Part D for the over 65, so we should see that start to level out that drug spend a little bit as we get the manufacturer rebates, but those are at least 6 months behind the date of the drug spend. So that's going to offset some of those expenditure lines.
So this retired column is just over 65?
No, it's both. The retired column is both under and overs. So prescription drug spend will vary.
Well, it looks like you got a pretty good drop there until August. It looks like your plan is always working good until August.
I don't know what I didn't see anything that specifically hit. So I can't answer your question, but we'll go take a look, and we'll ask the administrator if there was just a gut of claims that came through for some reason, or one particular one tripped off. That could be my Hep C person, but because it's on the active side of the house for that one. Hepatitis C, I got to remember to use the correct term. So. How retirees is high too. Mm-hmm.
Right.
And you know, people forget that because, you know, at the consumer level, they spend $15 for that generic prescription or $40 for that, but they don't realize that the cost of the prescription, their copay may be $40, but the cost of a script could be $800 or $900. They don't see that other side of the equation so well, unless your pharmacist happens to, you know, display that on there. Some do, some don't, you know.
Yeah, if they even get it, they send you something.
Yes.
If you really want to look at
The Medicare Part D plan sends you an explanation of benefits now. Every time you get a prescription drug, how much it costs, and on a quarterly basis. They send it. Yeah, exactly.
But it's there.
It's there for people to
And it
see.
lets you know how much the prescription actually was, and how much the medication actually was, what you paid and what you over the Medicare D paid.
Yeah. I don't know if there's another meeting at 9 o'clock, so. Anyway. But yes, that's we're trying to address that, and we're aware of it, so. Okay. Shall we move on to any comments from those with us in the audience today? Okay. I see no heads. Everybody happy? We're as happy as we can be. So let's call the meeting adjourned at 8:57. Okay, thank you. Yes, sir.